I'm Dr. Allan Serviss, and I'm a general surgeon here at O'Connor Hospital. And it's my privilege today to give you a little primer, a little 101 course on the incidence of breast cancer and what we can do to screen for breast cancer. It's the second most common cause of cancer deaths among women in this country. It's the main cause of death in women, period, between ages of 45 and 55. Probability of developing a breast cancer is roughly 1 in 6 women. There are several general risk factors: the use of alcohol, obesity in middle age, level of woman's activity during her middle years, more active lifestyle, less risk, more sedentary lifestyle, slightly greater risk. 82% of the cases of breast cancer occur in women over 50 years of age. The earlier the woman has children, the slightly less is the risk of developing a malignancy. Breastfeeding is found to be a protective element as far as development of breast cancer is concerned. The use of hormonal replacement therapy was very prominent back up until the 80s. And then there were some large studies that were done looking at women that had received postmenopausal hormonal replacement therapy. There certainly seems to be something of an increased risk, and the fact that we're seeing a decreased incidence of breast cancer would seem to suggest that we're beginning to see some effect as relates to less common use of hormonal replacement therapy. A very important risk factor is family history. It's reported that somewhere between 15 and 20% of women have had first-degree relatives that have had cancer of the breast. Those patients can be identified, can have genetic studies done, and then appropriate decisions can be made as to how they're going to be screened, how they're going to be followed. When we talk about screening for breast cancer, what we really want to do is we want to identify the possibility of a malignancy in the breast before it gets to the point where the patient can feel it. With the use of mammography, we've seen a dramatic decrease in the number of patients with advanced breast cancer. We have a new process, and we have it here at O'Connor Hospital, which is called digital mammography. It's really become the state of the art. For women between the ages of 50 or 70, annual mammograms are important. For women between the ages of 40 and 50, we need to discuss the risks and the benefits with their healthcare providers. For women age 70 or older, if they have a life expectancy greater than 10 years, then it's probably appropriate to continue annual mammographic screening. So this really is an introduction to the topic. It's an introduction to the problem. The good news is that the incidence of breast cancer seems to be decreasing. Even better news is the fact that with early diagnosis, the treatment can be much more effective, sometimes with much less surgery and associated disfigurement, and with likelihood that the outcomes are going to be much more successful than what we've experienced in the past years. Thank you for your attention.